All right, Katie, thanks so much for being a guest today on the Holistic Hub podcast. Really excited to dive into what we're kind of referring to as the mold detox debate today.
I am so happy to be here. Thank you for having me on.
Well, I want to start by just saying how excited I am to do this interview because, like, you and I have just talked off air so much, like through Instagram and through our socials, that there's just such a debate and so many different ways people can look to and information regarding like what they should do when they know they've been exposed to a water damaged building and all the things that come along with that. And you being so unique, being a shoemaker proficiency partner, but also having studied under Jill Krista and Neil Nathan, like taking their courses, you've really expanded your knowledge on the topic in a variety of ways. So that's why I think you're kind of the perfect person to bring on this episode. So I'd love to just start with hearing your story. Like, what got you involved in all of this? What got you involved in just expanding your knowledge, and like what led you to do what you're doing today with patients?
Gosh, well, it's a long story, but I will condense it. So I feel like most of us that get involved in this mold and CIRS space, it's usually personal because I feel like most people don't even think of mold as being a problem, right? Because we're usually raised, oh, it's mold, it's fine, it's ubiquitous. And so I kind of felt, to be totally honest, the same way. If you would have heard me as a practitioner 15 years ago, I literally said like, oh, supplements are bad. And I worked in pharma for 5 years and I was like very to be honest, anti holistic healthcare. It took me falling flat on my face with my own health struggles and I got functional medicine curious. And when functional medicine actually worked for me and I was healing and getting better, that's when I was like, oh my gosh, this is not quackery. I was extremely wrong. And the mold story basically was and I don't ever say this to sound cocky, but just like factually, and you were an athlete too, right? I was a marathon running dietitian. And so, on paper, like healthy, I guess you could say, right? Active, eating pretty well. And I moved into my house and I, did not know there was mold in it, right? Because I always say this on my personal account, home inspections are not mold inspections. So we didn't know there was mold in our house at the time. I started to gain rapid amounts of weight. I gained about 30 pounds and I'm only 5 foot tall. So it was a lot for my little running body. And that was kind of odd. And then I kept getting all these yeast infections and my hair started falling out and I was getting more fatigued and excess thirst and all these weird symptoms. And everyone just kept saying, oh, well, you're now a breastfeeding mom, you're a working mom, all the dismissive and reductive things. Well, my son started getting sick too. And long story short, he eventually was in the ICU and respiratory failure. And that was it was awful. It was our lowest low. And I had already had 2 mold inspections that said everything was fine. We got home from the ICU that day, literally opened up a wall with my hands, and there it was. And so that was April 2022. That completely rocked my world. And I obviously became very personally invested in fixing our house so I could help my son, and then connected all the dots. Well, these were also my problems too. And my daughter and husband had, I would say, lesser health problems, but it was like, wow, all of this was from mold. And I made it my mission to learn everything I could. Eventually went on to get diagnosed with CIRS, then eventually became a shoemaker proficiency partner. And we could probably get into all these details in a little bit, but what I was always so confused about was, well, I have CIRS and that needs treated, but I have all these fungal and candida issues in my body. And so what gives there? I have to have multiple approaches to heal my body because CIRS isn't going to deal with the fungal issues, and treating the fungal issues aren't going to fix my CIRS. And so here we are today. I've taken a very learn all I can from all of the top physicians and schools of thoughts, because I truly think not just me, but a lot of my patients need a multi-layered approach to heal. And that's the short and sweet of my story.
It's just so every time I hear someone's story, I'm always just like, still, it just like hits home for me, especially because I've also dealt with my own story, but just hearing you with your kid and just getting to the point where you just couldn't take it anymore. So you literally, did you say you took a sledgehammer? I think I've heard you say that to a wall, right? I mean, that just shows like, you're just like, okay, clearly like something is being missed. We have to figure it out.
Exactly. And that's what got me so passionate about these people are
Yeah.
right. Holistic healthcare, functional medicine, integrative approaches. There is a lot to be said for our environment. There is a lot to be said for things that might not perfectly fit in the confines of an ICD 10
Mm-hmm.
code. It's still bodily dysfunction. And that was one of my biggest aha moments because, as someone for 10 years working in endocrinology, as a diabetes educator, and then working in pharma, I was so, well, obviously I wasn't diagnosing, but find and treat the ICD 10 code and then do the intervention. And that was missing so much in so many of my patients' lives and in my personal life. And I'm like, I've got to
Mm-hmm.
take a different approach, learn all I can about functional medicine. And that is what I actually see move the needle for people. Because I feel like Western medicine, while we need it and there's a time and place for it, especially in
Yeah.
acute surgical emergency situations, it is very reactionary
Yeah.
and it's very, I could get on a whole tangent about that, but functional, I think, seeks to understand the why, seeks to resolve, not to just maintain. And that's where I basically did a 180 in my personal and professional life. And now my mission is to, very similar to you, right? Like educate, provide awareness, and help people become open minded to maybe how their body or why their body is like screaming in the form of all these symptoms and trying to connect the dots and figure it out
Yeah.
instead of playing what I say all the time on my social media, downstream symptom whack-a-mole.
Yeah, well, it's very, very clear following you for as long as I have how purposeful your mission is. And that's why I'm so excited to, dive into all this today because you've gone through it yourself. You've worked with hundreds of patients. You've done the research, you've taken the courses. You even have your own course on this. So, I mean, it's just, this is going to be a great conversation. I'm excited. And I really want to make sure we're like boiling this down to like, I want for those people, those patients out there that are just questioning possibly what they're doing. Are they doing the right thing? Like what information is correct? Like I want to just really like bring this home to them and like just make it so clear and concise that like, okay, like this is what this camp is doing. This is what this camp is doing. This is what this camp is doing. And this is how we can like create like a clear path forward because the body does know how to heal. It has the blueprint to heal. And we just have to figure out what's standing in its way. And then we can move forward with the right support. So that being said, when it comes to the mold detoxification space and the different camps, like I'm just curious, like what are your thoughts on like why there is so much disagreement in this space? Because again, we have the shoemaker space, we have Jill Krista, we've got Neil Nathan, we've got other approaches, healing, starting with cellular healing. I mean, the list kind of goes on and on. And so why do you think there is so much disagreement in the space?
That is a really good question. I feel like there's so many paths I could go down to answer that question, like the political versus the like more allopathic versus the more holistic
Mm-hmm.
approach. But the short and sweet of it is I think each protocol works and each person's or doctor's research supports what they're doing. But I say this a lot. Each one of the protocols is a tree in the forest of problems that could go wrong. And so if you only have CIRS and you're treating the CIRS with that protocol, you'll get better, right? If you only have candida or only have, and these are obviously like hypothetical situations, you only have mast cell activation syndrome. Okay. Yes, when you just do the one protocol, it might get better. But the problem, I feel like, with all of these various expert protocols, even though they are wonderful and they work, it's that people are dealing with a shitstorm of lots of problems. And you're
Yeah.
not going to fix your fungal burden on your body with the shoemaker protocol. And he firmly believes my protocol works, and it does. I've seen it work.
Yeah.
But like I said, it's the tree in the forest of dysfunction. And so people need a multi-layered approach. But I think people are just so stuck in their like one track thinking. It's too narrow of a lens.
Mm-hmm. Thank you for answering that. And that's kind of that's similar to the explanation I say. And what I always say to people too is that, mold is more than just a inflammatory response in the body, even though it can just be triggering CIRS for people, but it can be triggering that constant colonization of fungal colonization or persistent SIBO or, parasites that might not be able to be detoxed out of the body, or mast cell activation syndrome. I mean, the list can kind of go on. Like, we know so many things now are related to exposure to water damaged buildings. So you started talking about the Shoemaker protocol. I really would love to dive into that and just kind of explain it in like good detail for these people that are listening. So what does the Shoemaker protocol entail, and what exactly is chronic inflammatory response syndrome? Like, how do we diagnose that and identify that somebody is dealing with that?
That's a really good question, because you're right. We throw these terms around often, like CIRS and yada, yada, yada. What does that even mean? So CIRS, as you stated, chronic inflammatory response syndrome, is a multi-symptom, multi-system illness, not condition. The beautiful thing in that is it's resolvable. We just have to figure out what the trigger is and then appropriately treat it. So lots of details I can get into, but try to put it succinctly. How is it diagnosed? There's actually a free way you can start to work this up. You can go online and go to this website, www.vcs, Victor Cat Sam, vcstest.com, and take this visual contrast sensitivity test. It's like 5 minutes, super easy to do. Basically, if you'd get a positive score on this test, it means your optic nerve is actively detecting a biotoxin. Now, it doesn't say mold. It could be any biotoxin, right? Lyme, chemical warfare. It's a pretty big, a broad, list of biotoxins that could impact your optic nerve, but it does freely tip us off to, okay, optic nerve is detecting a biotoxin. So that's, I would say, step one. Step two, do you have cluster symptoms? They say like 8 out of the 13 different cluster symptoms. This basically just means a list of, is it 50? I'd have to look at the exact number, but it's like all these different symptoms. If you've got a handful of them, that's ding 2. Ding 3, if we're talking about water damaged building CIRS, because there's also Lyme CIRS and other types of CIRS. But if we're talking mold, water damaged buildings, that you have a known exposure. So doing a test of the house, and ERMI is a great way to screen for, is my home have clinically significant levels of toxic indoor mold or other biotoxins? That's a great thing you can screen for. Then labs, abnormal biomarkers. So that's what's called the CIRS panel. So looking at labs like MSH, TGF beta 1, MMP9, complement C4A, C3A. And if you have a handful of those abnormal, some say 3, some say 4, some say 5, but I usually just tell people a handful of those abnormal. And then technically, do you have the fifth part of the diagnosis? Do you have that a certain HLA haplotype that genetically predisposes you to that if you are exposed to mold or a water damaged building, that your immune system will likely struggle to tag it and remove it as foreign? And I know that's a laundry list of things, but if all of those things are present, that is how a person receives a diagnosis of CIRS. And like I said, some of that you can start to figure out yourself. You can do that free VCS test. You can go and Google the symptoms and see if you have them. You actually can go online and self-order a CIRS panel and an HLA haplotype, and then you can do an ERMI. So, I mean, you can really kind of figure this out yourself. Now, legally, of course, you should see a doctor for a medical diagnosis of this, but you can really start to figure this out because sadly, I'm speaking to the choir, you're aware, Western medicine, traditional allopathic healthcare systems do not diagnose this. This is not a part of standard medical school training. So many people fall through the cracks. I was one of them. No one ever brought this up to me. It took me figuring this out and ordering my own labs to be like, oh my gosh, this is CIRS, and then getting it, of course, confirmed with a physician.
So now if someone's listening and they're like, okay, so need to assess my environment. I'll do the VCS test. That's positive. Let's say they've gone through addressing their environment. We know that the first step of really any protocol, aside from Shoemaker, should be remove yourself from the water damaged building. And if we're speaking strictly from that perspective of possibly what is triggering this person's CIRS, right? Remove yourself, or, get a good professional out to support the environment, identify where the issue is, and then remediate, of course. We move on to these markers. So someone's like, okay, I'm going to get these markers. So when they come back and they're positive for, like you said, a handful of them, what is then the next steps in addressing in correcting the markers for that person? Like, what would be the next steps in the Shoemaker protocol?
That is a very good question. So, yes, what is this 12-step Dr. Shoemaker protocol? So, real quick backstory. Dr. Shoemaker is the reason we really have mold on the map as the potentially lethal biotoxin that it is.
Mm-hmm.
And all of his research, he was the real pioneer to kind of figure this out, and mapped out what's called the biotoxin pathway, which basically explains how all this dysfunction happens in the body. And then, of course, he went on to, well, how do you treat it? I believe the story is it was in the 90s. He was seeing all these patients that had very similar symptoms, and he was treating their high cholesterol with cholestyramine, but all of their other symptoms were starting to get better. And so, and they were all being exposed to, I believe, cyanobacteria or algae because it was a bunch of workers. He lived near, I think, a beach, and maybe a source of water where there was this contaminated water that all these people that were working there were getting sick from it. And he was a physician in that area and he was treating all these patients. Long story short, he made this connection that biotoxins not only can inhibit cholesterol biosynthesis in all these people at high cholesterol, but it can lead to this inflammatory state in the body. And then he was able to figure out, why do some people get sick and not others? It was this haplotype, or AKA gene, that genetically predisposes you, that when you get exposed to this, it then causes this cascade of this innate immune response that does not get passed over to the adaptive immune system to appropriately tag it as foreign and remove the biotoxin from the body. So he was the reason we got all this figured out. Well, then as years passed, he went on to actually like quantify and strategize his protocol. How are we actually going to go about doing this? Because it was kind of all happenstance in the beginning. So the first step is, like you said, and first rule of toxicology in general, remove the patient from the toxin, or in this case, the biotoxin, because mold is a biotoxin. And for people that haven't heard that term before, I sometimes joke, and this is like layman's terms, but like toxin is like dead and biotoxin is an alive toxin. And that's how I kind of break that down in my mind. So, anyways, goal one, remove the patient from the biotoxin. That can take time, right? To either remediate the home or, do the small particle cleaning, everything that we have to do to get the building objectively safe. So that can take a while. But in the meantime, you can at least start to move up on the Shoemaker protocol. And step 2 in his protocol is using binders. And the purpose of the binder is to help get up one of the first biomarkers, I say, is the first domino to fall in the cascade of the CIRS, chronic inflammatory response syndrome, is this MSH hormone. We breathe the mold in. If you're genetically susceptible, it suppresses the MSH because mold can cross the blood-brain barrier. And when the MSH is down, all sorts of other defenses are down, and why it can cause so much systemic dysfunction. So anyways, the purpose of the binder and his research, and this is what gets kind of gray and one of those hot mold war topics, is that he only really believes in cholestyramine and Welchol as bile acid sequestrants to basically attract, grab the toxin, and help you take the toxin to the toilet, essentially poop it out. And that over time, assuming you get out of exposure, can help increase that MSH hormone. And then there's other steps that go above and beyond that, treating MARCONs, correcting elevated anti-gliadin antibodies, and so on and so forth. It gets up to 12 steps. But I know I'm throwing a lot at this. That's kind of like high-level overview of starting to do the Shoemaker protocol.
Okay. So for somebody listening, because, I really want to make this so clear and concise for all the individuals listening, which you're doing such an amazing job. So let's say then we get to step 2. And so someone's going to start using cholestyramine to help to start to bind things out. Well, how long is someone typically supposed to be on that for, according to the Shoemaker protocol? And then in a sense because that is step 2, that's kind of like the overarching step to be able to lead to these next ones that you mentioned in this 12-step protocol. Is that what is ultimately supposed to be correcting a lot of these different markers? Or do we see the correction come from addressing colonization in the sinuses and MARCONs and things like that, and then going on a gluten-free diet and adjusting diet and things like that?
That is a great question. And so I would say that yes, the bile acid sequestration in his research, cholestyramine or Welchol, we're basically taking that over time to just keep continually grab and attract the toxins and help them leave
Yeah.
the body. And the goal is to get that MSH hormone up above a 35.
Okay.
Now, in tandem, you want to also be treating, which is step 2, the Marcons, which is an acronym for basically this overgrown staph bacteria
Hmm.
that it's kind of like a chicken and egg situation. If you've got Marcons in your nose, that can suppress MSH. And if you have a low MSH, that allows the Marcons to grow. So you usually have to tackle those two in tandem because you want to eradicate that overgrown bacteria and you also want to get that MSH up. And so, yeah, those two kind of need addressed together. But what's so interesting is they address that we need to kill Marcons, which is bacteria, but they don't always address, well, there can be fungus up there. There can actually
Right.
be mold in there too. On my Marcons panel, not only was I Marcons positive, I actually had legit mold growing in my nose. And people, I know that kind of weirds them out, but this is where, a or an antibiotic only approach, that's not necessarily going to kill the candida. And this is where criticism of the Shoemaker protocol starts to come in. And I agree with this criticism. I revere the man. He mapped out so much of this
Yes.
and his
Absolutely.
protocol works. With the caveat, though, that which gets so controversial is, but what about all the colonization issues if we don't address the fact that, and the very real reality is that people will have candida growing in their body, actual mold growing in their body. They might have SIBO, they might have SIFO. If that colonization is there, I'll say this expression a lot on my social media: game over. You became the moldy house. You could have left
Yes.
or remediated, right? Your moldy
Mhm.
home. But if you are colonized, we've got to address that colonization. And the Shoemaker protocol does not speak to that. And this is where, like you said at the beginning, I feel like I take this very unique stance that, and I always joke, I'm a Gemini, and I'm also like Switzerland. I have like 1 foot in, 1 foot out of all these different camps. That it's okay, in my opinion, to say the Shoemaker protocol is great,
Mhm.
but it's also okay to say there might be a time and place for antifungals.
Yeah. Absolutely. And I think that's what makes a valuable and amazing practitioner is when like you have that open-minded approach to things, right? Especially when we have new research kind of coming out to support these different facts, right? And I have a few things that I want to comment on, but I'm going to start kind of with the binding. So with cholestyramine, I have had quite a few clients come to me. And again, it's like with any field with, I'll throw all kinds of practitioners out there, even in the functional medicine world, right? Like we now see people just throwing supplements at people as opposed to like kind of in the Western medicine world where we're throwing medications. So it's like, again, like it all boils down to like who the practitioner is and how much they know and how much, experience they've had and things like that and helping people in this situation. But, I've had different clients actually come to me that were on, cholestyramine for X amount of time for quite some time. And actually, a couple of new clients recently, discovering that they have pretty severe nutrient imbalances as a result of that binding. And so whenever I've had anybody ask if they think that I would recommend cholestyramine, I have nothing against it. I love Shoemaker's work. Like you said, absolutely revere him for the work that he's done in being able to, bring this approach to the world and helping so many people and getting this started. But I think that with any protocol, even antifungals, things like that, like we have to be careful with how much and how intensive a protocol I think we're putting on some of these people. And so I'm just curious, this is my first question in regards to the binding piece is, do you have like a recommended or set amount of time you think is probably best to be utilizing cholestyramine to help bind and then maybe transition to other binders if you're still seeing this person needs that, bile sequestrant support?
Oh, that's a great question. So I've heard a lot of the middle ground approach practitioners say maybe a month or two of cholestyramine.
Hmm.
Sometimes, though, that's not enough to get the MSH up. And so then I think the question is, well, is there still colonization in the body? Is there still exposure? And I do think it's fair to utilize different binders. I actually personally used Pectisol the first time and it worked for me. I wasn't on cholestyramine the first time I resolved my CIRS. And so I think it's totally fine to lean into other binders because you are correct. And this is another top criticism of the Shoemaker protocol. While cholestyramine is a great binder, some argue it binds too well, and then you're mineral
Yeah.
depleted. Well, then the downstream effect of that is, okay, a lot of minerals are needed to make stomach acid. And we need plenty of stomach acid and bile flow to actually have great motility to move all this through. So if you're throwing all these binders in, but you've got low stomach acid, you're not pooping well, you've got SIBO growing. This is, I think, why a lot of people say the Shoemaker protocol doesn't work for them is, and I think there's a lot of things you could get into of where maybe it falls short, and it's not always the protocol. Sometimes, the person's still exposed or something else is being missed. But yeah, you really have to, like, I think view it as one tool in the toolkit is what I will often say to people. It's one tool in the toolkit. It's okay to come off of it for a while. It's okay to try other binders. It's okay to zoom out and look at other approaches to see if there's other things that maybe are being utilized. And then actually something I'm personally getting into, because I have CIRS again, but this time from Lyme, is I'm looking into peptides. Some say that it's not just about binders to get that MSH shot, but if you've got such a beaten down immune system, which I do, I have a very low CD8, CD57, maybe I need to be working more on terrain and immune system function to get my MSH back up. And so that's a whole other new area that I'm exploring on a personal level, because I've been on binders on and off since 2021.
Okay.
And when I did an HTMA test on myself a year or so ago, you were right. Completely depleted sodium and potassium. And that's not great either for healing. So yes, long story short, a nuanced approach is something I very much believe in, and understanding that there's pros and limitations of all these tools in our toolkit.
That you said that so perfectly, and that's what I like to refer to all these things. I like to refer to all these items as well as it's like a tool in the toolbox, right? And so it's like we can like evolve too with these people that are struggling with like maybe utilizing that approach, and then like starting to address other areas like colonization or other binders or other things that we can do to support this person, mineral replenishment, right? Like there's multiple things that we need to look at. And it's basically like taking that like wide lens view of like, what is this person dealing with and what can we start to like support them? Are they starting to feel better on this? Well, that's really important, because how this person's feeling is going to be much better than any test is going to show us, right? So we want to get that person better. So I really love how you stated that. The other thing I wanted to comment on was earlier when you were talking about fungal colonization, I did a post on this a couple of weeks ago talking about SIBO and how, addressing, and oftentimes, especially with mold, and then, we know that like so many people with mold are dealing with chronic SIBO. They've done rifaximin a million times. They've done, they've tried to address their methane with allicin and all these things, and like little to no relief, or it just keeps coming back. And if we're not addressing the sinuses, if that person had that mold exposure, every time we swallow, we're essentially seeding the gut from whatever is colonized in the sinus cavities. And that is what is such an important piece. If somebody's really dealing with recurring SIBO, I'm just going to put this out there. Check for mold, check for mycotoxin exposure, right? Like mycotoxins in your system, so important, because that can be a real leading cause to it. But Joseph Brewer in 2013, like he had this proposal where a lot of chronically ill patients, it's due to that fungal colonization too. So I really appreciate his work in that, bringing the fungal piece to the table. And I guess that can kind of allow us to transition into some of the other approaches, unless there's anything you have left to say about Shoemaker, but kind of, transitioning over into like Jill Krista and Neil Nathan, where they utilize binders, Neil Nathan more than Jill Krista, but again, really addressing the colonization piece. So I'd love to really hear about your opinion, and I guess if you've utilized their approaches as well with the antifungals, with utilizing different binders. Sounds like you have, because you're used with Pectisol and MycoBind. But love to hear your views on their approach.
So I think, like you said earlier, like this zoomed out lens, when we're looking at a person, they come to you, they've got these symptoms, they've tried a lot of things, like you said, they keep treating the SIBO, they keep having weight loss resistance issue, brain fog, whatever it is. I think symptomatology is something that very much gets neglected, and people sometimes get a little too testing focused. And obviously I'm very for aggressively testing and figuring out what's going on, but leaning into the symptoms, because I think the symptoms often tip us off to this is what could be going on. And so many patients I see, and this was so personal and why I became very like open-minded to Shoemaker, and I did Jill Krista's course and all this other training, was because so many people come to me with the classic CIRS symptoms and they have candida issues. For women, recurring vaginal yeast infections. And a lot of times they don't even connect the dots, or recurring BV. Oh my gosh, that also could be from mold.
Yes.
Thrush. I usually will say, show me your tongue. And okay, white tongue. Maybe if it's not full on meeting criteria for thrush though, but if there's starting to be some white fuzzies there, okay, what's going on? They got an itchy scalp. I mean, all these things that can tip us off to there could be not maybe a full on infection, because true candida infections are more rare, I guess you could argue, but this overgrowth in the body. And so I think, asking them questions. And on my intake, I have this like, tell me everything that's going on, not just like what you think the problem is, but like, what are all these other, what you think maybe has gotten brushed off by a doctor, but might actually be an issue or point us to something. But then from there, a lot of people do like data. I think looking at like an oats test, candida antibody panel. I know I'm missing. What is another one that I commonly use? There is the serum mycotoxin testing from Dr. Andrew Campbell, but that's not really directly telling us if there's candida in the body, but he does believe in using antifungals to treat that. But anyways, I think doing a test and looking at the symptoms is a good idea. And I use antimicrobials with almost all of my patients, especially because most people do have some sort of candida burden on the body. And I know what I was forgetting that I just remembered. There is this screening questionnaire that's been validated. I can't think of what it's called off the top of my head, but do you know what I'm saying? It's like this candida screening questionnaire.
Oh, yes. I can't remember the name either, but yes, I'll link it in the show notes so that way people can look into that as well to identify. Yeah.
Yes, that is a very good screening questionnaire that if you get so many points on it and you ask or answer all the questions, that it basically says, yes, there is a candida burden on the body. We should likely use antifungals. And so I will use specifically things like Candid X. I use a lot of ADP. I will use monolaurin. I often have people use or eat coconut oil. There's so many tools in our toolkit to try to help eradicate that candida over time, but also simultaneously dealing with things like low stomach acid and trying to help make it so that there's a terrain in which these pathogens don't want to overgrow and take over.
Absolutely. And it kind of goes back to what you said that you've been personally diving into is like the terrain piece, right? And that is absolutely huge. It's like, we can like try to, bind and, take out all these like, overgrowths as much as we want. But if we're not simultaneously working on the terrain, which I know you do a lot of with your patients, is like so important, like stomach acid, migrating motor complex, digestive enzyme support, gallbladder and bile flow. Like there's so many things that we can look at because a lot of times those are the mechanisms in the body that fail the immune system, right? There's like 70% of our immune systems within our gut. And so there's so many of these mechanisms that kind of start to fail. They're protective mechanisms that are there to keep the terrain good and healthy and prevent these overgrowths from occurring. And so it's like identifying what's going on, treating it properly in the right order, but then also simultaneously fitting in that terrain support because that's really important. Like very, very important to support the body in numerous ways.
Dr. Jess Petras, I'm not sure if you know who she is.
I do.
You do. I love her. She has this very famous quote, and oh my gosh, I'm going to botch this. Oh gosh. It's stagnation breeds illness. And that when things are dysfunctional and there's not a real good assembly line of things moving through the body, this is often why SIBO will keep coming back. You can go in and kill.
Yes.
But if there is impaired bile flow and it's all sludgy from the mold exposure, or there is low stomach acid, that you have to keep supporting this, like, I always say assembly lines. I think a lot of people can visually see that in their mind, like, oh, goes from here and then to here and then to here. And I also really like regardless if you love or hate Cellcore products, I love their funnel. Do you know what I'm talking about?
Yeah. Oh, yeah.
Their detox
Yes.
funnel. It
Yes.
explains it so well. And I'll
It
usually
does.
show that to patients in one of our first appointments as we're mapping all this out. Like, okay, we've got this and this and this here. And so many practitioners
Yeah.
like isolate on, oh, I'm only going to do a Dutch test and like manipulate the hormones. Or I'm only going to order a GMAP and we're going to eradicate. But when you map out everything and see how it all works together and maybe why that this keeps happening, I think that Cellcore funnel is really good. We've got to start with the gut, deal with
Mhm.
overgrowth, then go up higher to the organs. Well, what's going on with the gallbladder? What's going on with the bile? Does the liver need support? So we actually can pass it to the gallbladder to then go to the gut to then have it all funnel and then keep going higher and higher up, lymphatic support, etc. And so I just personally love that model. That was also one of the first things that I got real functional medicine curious about, because I think that was the very first binder I ever took was a cell core binder when I was starting
Oh,
to
yeah.
connect the dots that mold was there. And I do think cell core products can work very well. I think my issue at the time was I was still in mold. And so step one, I was missing step one. But anyways, they have a really good framework. And so
They do.
I use that framework a lot with people. It sounds like you implement a similar framework as well.
I do, yes. And I want to also, I'm going to comment on two things, but one, I really like what you were saying about her line there with stagnation, because I actually just did a post up today talking about like one of the key things that like moving, like with mass, I was actually talking about mass activation syndrome, but this I really feel like applies to everything is like get the momentum going and like get things just moving. That's what we need to do.
Yes.
And just kind of get things moving, right? Momentum is key. Gentle momentum, of course, but yes, we got to keep things moving. And so, yeah. And then the other piece is what you were just referring to. Absolutely. Like, I'm so big on the terrain, on the immune modulation. I think that is so key when implemented right at the right time. And then like, again, like one other thing that we didn't even talk about, but I know you had mentioned this the last time we were chatting about this was H. pylori. I mean, like that is so huge in mold exposure. Like I dealt with that big time.
Me
I
too.
had horrible reflux. Oh my gosh. And that gnawing, burning sensation in my stomach. I mean, so it's like, that's just a lot of these things can be kind of clue-ins. Like when you're just like one thing after the other, it's like, what's in the environment that's really triggering this? Because like the body just doesn't become dysfunctional. It becomes that way because it's being beaten down and it just can't support us anymore. And all those protective mechanisms we've been talking about this whole time, especially the gut, break down. We get the leaky gut. We get all the things that collapse kind of around it as a result of it. And then we see the mast cell reactions occur. And that's why a lot of these things that we see, like SIBO, mast cell sensitivities, nutrient depletion, all this stuff, it's really it's really like symptoms of like what we're being exposed to, or, there could be other reasons. But again, really like there's something bigger that we need to look into, especially when you're coming in with like a cluster of symptoms. Like I know you're seeing a lot of those kinds of patients.
It's almost always environmentally acquired. And,
Yeah.
call it anxiety, call it IBS, call it whatever you want to call it. When you get to the rootiest of root issues, almost everyone is dealing with that, having had signs and symptoms and all these
Mm-hmm.
problems that can't be figured out. It's mold, it's endotoxins, it's
Yeah.
actinobacteria. I do want to comment real quick on the H. pylori because I see this all the time. Patient went to their gastro. They either got
Mm-hmm.
scoped, biopsied, breath tested, stool tested. Well, H. pylori was negative. Those tests are usually a pass fail. And so it wasn't the worst of the worst H. pylori, but they still sometimes have enough colonization that when you do a GI map,
We
it's
can
like
pick up
ding,
on
ding,
it.
ding. It shows
Mm-hmm.
up positive on there. And so they maybe were like 80 or 90% of the way there, but it wasn't full on 100% where Western medicine would flag it as disease level or whatever. And so I see this so often that the patient's like, we already looked into that. I'm like, let's do a functional stool test. Let's see if there's lower lying, maybe subclinical issues
Mm-hmm.
going on. Because yeah, sometimes they keep throwing rifaximin at it because they know they have SIBO. They keep treating the SIBO, but the SIBO oftentimes keeps coming back because of the H. pylori.
Yes,
And you've got it. I've
absolutely.
actually seen that a lot with my mold impacted patients, and why I'm always very pro. If they come to me with an H. pylori test, they're like, can we just keep doing this? I'm like, we really should do a GI map and see what else is going on, because 9 times out of 10, you'll see H. pylori in there as well. And the mold makes us more
Mm-hmm.
hospitable to the H. pylori. And H. pylori doesn't always respond the same way to a SIBO protocol. You often have to hit the H. pylori harder and do other
Yep.
things. And oftentimes the H. pylori is contributing to the low stomach acid and the nutrient depletion.
Oh,
And you'll
big
see low
time.
B12, low iron, and people keep throwing B12 supplements and iron supplements at it, which can help, but it's not
Yeah.
fixing, again, the rootier of root issues. And yes, I'm so glad you brought up the H. pylori because, yes, oh my gosh, I see so much H. pylori. It's so highly contagious.
Oh my gosh. Yeah. I agree with you 100%. And if I have to say another thing on top of that, is like with recurring SIBO or like persistent SIBO, I really see, I mean, there's a lot of root causes actually to SIBO, but if we're kind of thinking of it from like this overgrowth perspective, I'm literally thinking sinuses. Are we thinking H. pylori, candida? I'm thinking of those things that like need to like, I'm like, okay, why is this person? And then overarching, we're dealing with mold. What type of exposure environmentally are we dealing with? So I'm really glad that we did touch on that because I think that can be like a big piece for so many people is like, sometimes someone's mold symptoms are just in the gut too. Like they're just dealing with like primarily like raging gut symptoms. And so really important, like binders are great and that's important, but we need to really address the gut. And that's like, again, base. So love that you brought that up. And kind of on that topic, because we were talking about testing, like you brought the GI map up, you GI map test up and other different testing options as well. But one that we actually haven't touched on yet is, again, kind of looking at Neil Nathan, Jill Krista's view is their pro urine mycotoxin panel. And so we'd love to hear your thoughts on utilizing that approach. How often maybe you're doing that with your patients and are you using it as a way to like track, decreasing the mycotoxin load in their system?
That is a really good question. So I know this is going to be very controversial to the shoemaker camp, but I do order urine mycotoxin tests. And a lot of people that are shoemaker proficient or certified are like, oh my gosh, no, those tests have no value. I will say, in the grand scheme of things, because functional medicine testing can get costly, and I'm always about what is going to give us the biggest bang for buck? What data do we really, really need here to
Yeah.
make an intervention that's going to nail it? I will
Mhm.
sometimes have that drop off. I do think sometimes it's more important to see the Marcons, the MSH, because the MSH, I do have a very like North Star with that I need that to get up above a 35. So I do order the urine mycotoxin test, and here's why and when I'll do it. If I have someone who's what I call mold curious, but they really don't want to do blood work, or they're like, I don't want to spend the money on the CIRS panel because that gets more expensive. I'm like, let's just see. Would you pee in a cup for me? And so sometimes people are more open-minded to, sure, I'll do a urine test. That oftentimes is, I call the gateway drug for opening their eyes to the possibility that
Yes.
mold is making them sick. So I will use that very much when someone is like, oh, I just don't know. My house is new. And they'll say all these, and I say this with love because
Oh, yeah.
I was one of these people too. Well, they'll say one of those mold illness denial phrases. Well, my house is new, or my house is
Hmm.
old. It was better craftsmanship back then, or but I live in a dry
There's
climate.
always something.
All of the
Hmm.
phrases, right? And so I'll say, well, let's do a urine mycotoxin test. And then it's like dot, 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 ochratoxin, aflatoxin, citronine,
Yeah.
gliotoxin. You'll start to see all these positives,
Hmm.
and I can just hear it. So I'm going to address it. There's a shoemaker person sitting there saying, but some of that comes from food. And you can have a healthy person have urine mycotoxin show up. Yes, yes, yes. I agree with all of that. But are they symptomatic? Okay.
Yeah.
This is likely more of an environmental exposure. And um, it's at least tipping us off. Then what
Yeah.
we can do is we can do an ERMI of their house and see, is there tons of aspergillus, penicillium in there? And then we see in their urine test, there's
Yep.
ochratoxin. Like, this is tracking, you
Hmm.
guys. What we're seeing in the environment is in the house. And
Absolutely.
I feel like that data is super validating for people, especially when you have one partner or the spouse that's sick and the other one's not. And they're like, no, it couldn't be my house. When you show the urine test, you show the ERMI test, there's a lot of dots that can start to connect there. And I
Yeah.
personally don't view food as the big culprit that makes us mold sick. I mean, yes, it
Me
can.
either.
It can show up in that urine test, but
Hmm.
again, it's usually not causing illness. And what you could do is you could have people stop a lot of possible high moldy foods leading up to the test. But I know I'm going off on a tangent here, but yes, long story short, I do
Yeah.
order tests. I do think there's value. I will sometimes put it on the chopping block if, you know, in the grand scheme of all these functional tests, maybe they have XYZ amount of money. I'm like, okay, we might put that one on the back burner, but I do think the tests have value. I think it's so interesting when you hold it up to the environmental testing.
Oh, definitely. And the way you explain that was saying, again, are we the symptoms, the ERMI, the environment, history, and then, the actual data that we see in front of us. And then, I mean, you can't deny it after that point. And yes, you can stop moldy foods. I'll usually have people stop it for a few days, like kind of leading up to, if that person isn't dealing with like, crazy food sensitivities, because the last thing we want to do is obviously decrease their food tolerance more. But yes, definitely. I love the way that you explain that. And I think it's a great way to just like open somebody's eyes. Like if somebody's like, especially, I'll have a lot of people come to me just to treat their SIBO. But it's been years, and I'm like, well, let's get a good history. Let's see what's going on. Like, what have you possibly been exposed to, and discover that they've lived in mold in childhood, and then again in their 20s, and maybe in the dorm room there was a huge flood, which I get that a lot. And so again, and it's like, and then we see the testing, and then it comes up, and it's like, here we go. We have an answer. We have a great answer, and we can like really move forward with that. And so I like that you explained it that way. It's kind of like this eye-opening piece, because that's how I view it as well. It's like very eye-opening. And this leads me to another topic regarding binders again. So we have Shoemaker focusing mainly on Welchol and cholestyramine, but we have other binders. Like you already talked about Pectisol, you've talked about Mycobind. We know there's activated charcoal clay, all the clays. We've got different probiotics that can work. We have aloe. We've got, the list kind of goes on a little bit there based off of some different studies that we have. And so, what are your thoughts on, you kind of already touched on this, but your thoughts on some of these other binders as well as, compared to the pharmaceutical ones. And then are you a fan of like maybe like rotating binders as well as like kind of like with the antifungal piece implemented? And my other question regarding this too is kind of the order, because you said Marcons is very important for you to really identify, because you want to make sure you're addressing that. But if we're dealing with colonization in the sinuses or Marcons, was your order of operations like binder, antifungal nasal sprays, or sprays, and then utilizing ones for the gut? Or will you just go straight into the sprays? Like what, if someone's listening here, they're like, okay, I know maybe some tests that I could run, but then I don't really know like what order I would need to go in. Do you have a specific way that you see work best?
Yes.
That was a loaded question.
No, it's a great question. And that's
Okay.
like what my course hits on, because there is the sea of functional testing, right? And you've got what I call some lukewarm practitioners out there that like are one trick ponies. And we do the GMAPs and the SIBO test, and we keep treating it. We do the Dutch testing, we do the urine test, we do the binders, but not everyone ties it all together. And this is how sometimes people get stuck, as they're doing a subset of the problem, or they're addressing a subset of the big issue. And so this is kind of my framework here of, I suspect a mold sick patient. Oh, I want to interject real quick, because you said something that I was like, oh, I feel this to my core. Someone comes to you with SIBO, or I see all the time on my scheduling comments, because people can self-book online, and I don't do like discovery calls. They'll just show up on my schedule and it'll say, I'm here for IBS. I'm here for weight loss resistance. I'm here for recurring SIBO. And it's all mold. And a lot of times it's like I have to get them in open-minded to, yes, okay, it's mold. But eventually people get there if they're like, what I've been doing with IBS for 20 years. Anyways, I had to comment on that, because I totally agree with you.
Thanks for sharing that.
It's the scheduling comment rarely lines up with what the actual problem ends up being. But we have to start somewhere. And it's not that their IBS isn't real. Like there is something going on. It's just, is that really what the rootiest of root issue is? Okay. So sorry, I diverted there. Framework. If someone comes to me, the very first thing we work on is pooping. We've got that cell core, we got to get you going, figure out motility issues, and I'll start to go there. And then often that segues into testing, because sometimes people have been dealing with these problems for so long. They've already tried high fiber diet, fluids, vagus nerve stimulation, breath work, etc. So I usually will go right into the functional testing, and we'll kind of see, well, what's going on with gut, because I truly believe if the gut's off, that is a huge barrier to detoxing and eventually, dealing with the mold colonization piece. I am going to take a step back, though, before I even get to the gut. If a person has MCAS and or histamine intolerance issues, I'm dealing with mast cell stabilization first. I should say that. So if they're highly reactive, they're eating four things, we're working on what can I do to get them more bandwidth. And we're doing
Definitely.
usually an ERMI of the house and we're trying to get them out of exposure. So I guess I should say goal one is working on figuring out if there's exposure, mast cell stabilization to give them more
Yep.
bandwidth and more comfort and safety. Sometimes I will refer out to a
Yes.
physician if they maybe need prescriptions, but there's a lot of really good over the counter
Oh, yeah.
mast cell stabilizers. We can either mast cell stabilize, work on histamine clearing, histamine
Mhm.
blocking, lots of angles we can tackle that because we've got to get them comfortable and safe, right?
Definitely.
So I should say that's like, if that applies, that's what I'm first doing.
For sure.
Then we're doing gut. We're working on, getting SIBO and or GI map test, what dysfunction is going on there, supporting motility, optimizing their migrating motor complex, eradicating, which almost always I find there's got to be some sort of eradication going on. And then the detoxing component. Now, sometimes I'm simultaneously, if there's a big candida burden on the body or SIBO, I'm starting to use some binders to soak up
Okay.
the die off.
Yeah.
But eventually the gut stuff gets better. And then we're doing more maybe long term looking at binders and again going up higher on that cell core. And then I start to really focus on liver optimization and screening for and correcting deficiencies. Because I say this a lot too, our liver, I can't stand when you'll hear
Yeah.
physicians say, oh, but you own a liver, you're detoxing. It's like, oh, it's not that
Oh,
simple.
yeah. Gosh. Mm-mm.
There's a lot of cofactors and ingredients that we need to give the liver so it can best package up and ship out those toxins and then go through the
Mhm.
body. So then we'll work on correcting deficiencies, which takes some time. And so I guess
Yeah.
and sometimes I pivot kind of depending upon the person, but that's kind of my general framework is mast cell
I love that.
stabilization, working on the gut, binding, nutrient deficiencies, somewhere in there, Marcons. But I also work with people depending upon what they will and won't do, because sometimes people have hard fast. I'm not ready to do that right now. I will respect that. Their
Yep.
finances, if there's other comorbidities that we have to work around, um, and we can't do something, for example. But I guess yeah, that's kind of like a high level overview of how I'm starting to tackle these things for people.
Oh, I love that. I absolutely love that with, focusing on like kind of like your order of operations. And I have a very similar one as well, because again, everyone's going to come to us, everyone's so individualistic. Like we're going to be needing to like take again that like wide lens view, take what we can from our toolbox and support that person and like what they're currently dealing with, the symptoms they're dealing with, what's showing up on their testing. And from what it sounds like, just to kind of clarify for people, so it sounds like you do obviously want to focus on that terrain, the gut piece, obviously optimizing movement. That's really important to get things going. Obviously check exposure, but then that's where kind of like addressing the Marcons or colonization and then utilizing the antifungals seems to come in. I just want to make sure that that's kind of, am I saying that correctly with how you'll, okay, because I do a very similar approach.
Yep.
So it sounds like we're on the same page. Yeah. Perfect. Okay. So let's talk about some other tools in your toolbox. So we can talk about like nervous system regulation. There's other things that, practitioners like to utilize. Like you touched on peptides a little bit. Like that's, in and upcoming with support, which I love that for support as we've been starting to work on the body and repairing and getting to that point. I don't usually recommend as like the first thing, but absolutely as we start to kind of address what's going on in the body, absolutely. And so I would love to dive into nervous system regulation with you and how often like you're recommending this for individuals, or is there any specific things you see work well for people and like maybe the timing you like to implement that for someone?
Gotcha. So I personally feel that if there is a physical biotoxin issue, tackling that first is going to be so crucial because it can often cause a lot of nervous system dysregulation. However, in the same breath, nervous system regulation tools can be very helpful, especially while you're dealing with such a stressful time in your life, figuring out that there's mold in your home and trying to deal with remediation, et cetera. So, I mean, I guess you could argue, people argue all the time over start with nervous system supports. Some people say, no, work on the physical. You can start to do both at the same time, but I will say I do feel like it's really hard for all the nervous system supports to work
Yeah.
if there is still a physical problem going on. So I do routinely recommend using various tools. Me personally, I'm really big into walking. I call them my anxiety
Mm-hmm.
walks, or if I'm like calling my sister when I go out around over lunch or something, she'll
Oh.
joke, "Are you on your crippling anxiety walk?" I'm like, "Yes." It's my decompression time. And
Yeah.
they say sometimes with walking, like your eyes will go back and forth and you're kind of like EMDRing
Mm-hmm.
yourself. So I think walking is a really great free tool to help support your nervous system and many other benefits too, right? I am huge into red light. I know this is probably not quite
That one too.
just nervous system support stuff, but I personally find it very relaxing if I'm had a stressful day, whatever, to just sit with this thing. And like, I feel like I'm at like, this is going to make me sound so like early 2000s, but like at a tanning bed, which obviously is not good for you, but it takes me back to a time in my life where that was relaxing to go lay in the tanning bed, horrible for your skin. But I personally find it's like, I don't know, the red light is so calming. I do think breath work, holding your hand
Yeah.
on your chest and on your belly and doing some deep belly breaths can be very helpful. And that's another free tool. So, to answer your question, yes, I will recommend people start
Yeah.
doing some basic, and not even just basic, that's probably not the right word, some self care behaviors,
Mm-hmm.
because when you're in a chronic state of fight or flight, that's also not great for your immune system either. So, yes, to answer your question, I do think it's important.
Yeah. Awesome. Oh, and I'm gone. There I am. Okay. That was hilarious. Okay. Yes. I also love nervous system regulation. I think it is such a key part, especially I think it should be implemented personally, kind of like right away. But again, I will preface it with telling people, this is going to be helpful and build like build a good foundation, but we do need to address the biotoxins. Like if you're still getting exposed in some way, shape, or form, right? Or there's a high load in your system, like there's really only so much that we can do, but it's going to build that foundation and like do kind of like what works for you. Like I've got a handout on my favorite exercises. I love limbic retraining. I love, primal trust and Gupta and all these things. And it's kind of like, what is working best for you? Because sometimes when people go directly into these like big programs, it's overwhelming too. So it's like we got to work on with what we got. And so I'm a big fan of like, utilizing the nervous system support. I actually had Ashok Gupta on my podcast really early on. And one of the things he said to me really struck home for me. And I have to say it was a big piece for me in supporting my clearance of SIBO after I addressed mold. But he had said, he was like, in my humble opinion, I actually really think SIBO is the result of limbic system dysfunction. And I was like, that is so interesting. Wow. And the vagus nerve. And that's really what got me thinking about how the nervous system is so tied in with everything. And so, again, time and place, doing what you can do. I also love red light. I love my PMF mat. Like, there's walking, sunlight, like, so much we can do to support. And it's kind of about like, what can that person fit into their day? What can they do without feeling overwhelmed? And then just kind of like laying the foundation for starting to tell your body like, hey, it's okay. Like we're working through this. And a lot of these, histamine symptoms and mast cell symptoms and cell dysfunction is from the body essentially feeling unsafe. So if we can start to build a foundation with clearance of what's triggering all that, but also supporting the nervous system, I think we can really get a lot of bang for our buck there.
It is an introductory conversation I have with patients, sometimes at that very first appointment before we have any data, especially if they've come to me with no testing.
Yeah.
I'll say this kind of story to patients sometimes, whether they have IBS or SIBO, or we think that's what's going on, that if you're running from a bear or you're in a sympathetic dominant state, your parasympathetic normal bodily functions are kind of like shut off, down regulating. Your body's like, yeah, digestion is not a priority right now when you're running from someone. So the bile flow's not as great. The stomach acid production's not as great. We do really have to kind of be more in a calm rest and digest, literally why we call it,
Yeah.
right? Rest and digest, because then that's what allow the juices to flow and for things to
Yeah.
work. So it is really interesting that they said it and worded it that way, that SIBO is the result of,
Yeah.
I think you really could argue that. Like,
Yeah. And
obviously there's
kind of a
physical
case for,
stuff too.
right.
But yeah, no, I love how we worded that. I'm going to start I'm going to start using that more because obviously, yes, like the mold and the physical issues can lead to SIBO too. But yeah, that is very insightful.
Yeah, I thought it was a very profound statement that I don't think he realized would be so profound with me, but I was just like, wow, that's amazing. And then, I actually, took, Dr. Allison Seebecker's courses on SIBO, and like she's known as like the queen of SIBO. I had her on the podcast as well. She's a delight. Like she's so wonderful. And, again, like one thing she talked about with persistent, in her courses, she talks about persistent, SIBO is looking at nervous system dysregulation, particularly like with methane SIBO, which was very, emo. And that was very insightful again. And so it just got me to thinking like, it's just another tool we have. Like we can look at that piece and introduce that, right? It might not be the only thing, but it can be part of it. So, thank you for sharing your thoughts on that. I think it's really insightful and important for people to hear a little bit about the nervous system piece, and that it's, not a one size fits all, but we can utilize different things that just work best for you. So with this all being said, we kind of went through the different, approaches and protocols and things like that. So just a couple more questions to kind of end the conversation. But some people are, I have a lot of people that ask me, how long is it going to take for me to get better? And in your experience, when someone's dealing, like, let's just say it's mold exposure that they're dealing with, that's triggering their CIRS, triggering their other symptoms. I mean, it's going to be very patient dependent depending on what they're dealing with. But like, is there kind of like a specific timeline? Like you'll tell people like, on average, I see people get better in like probably X amount of time. But of course, dealing with detoxing and all the, all the stuff that mold can do to our system, like it takes time to kind of rewind that too.
That's a great question. I actually get that question a lot when working with patients one-on-one. I think in Western medicine, a lot of things work relatively fast. And so we have to kind of manage expectations that I generally tell my patients, assuming they're out of exposure, like it was like you had said earlier, like a dorm, old janky college apartment, something like that. If we're out of exposure for real, I think it's fair to say 3 to 6 months. We'll make a lot of headway. And with the gut stuff, if we figure out the rootiest of root issues with the SIBO and we're supporting minerals, bioflow, prokinetics if we need to, a lot of my patients, a lot of their gut issues, like a couple months, we're way well underway with feeling better. And then obviously it takes a while because I joke, you can only detox as fast as you can poop. So the mold and things are only leaving the body with bile. With a bowel movement. I mean, yes, some comes out the skin, but I want to say I've heard some of the top CIRS doctors say like it's, what's the word I'm looking for? Like 70, 80, 90% of biotoxins are going to leave through the stool. Yeah. So really optimizing gut function. And then, getting that MSH up, the Marcons eradicated, a lot of the other trickle down things that happen. I would say 3 to 6 months is like probably a best case scenario. I would say for a lot of my patients, it's more 6 to 12 months. Yeah. A lot of people, though, they're still in exposure. So then you're working on getting, the mold inspector and remediator out. You're figuring out whatever, needs to be done to the house. Is it an isolated room? And a lot of times it's not like the whole thing's a tear down. It's usually something specific like, oh, this pipe was leaking. This drywall needs taken out. We need to rebuild this room back up. Small particle, clean your whole house. That can take a month or two or whatever, depending upon when your contractor can get out and do everything. Or maybe you're leaving, you're moving and you're going to a new apartment, finding a new apartment, moving. So I think 6 to 12 months is probably a much more realistic for most people time frame. And then if Lyme's involved, I'd say you're more looking at 18 months, a little longer. But the beautiful thing about this, what I always tell people, I know that can hear daunting to hear like a year. It is something that can go away. We can resolve CIRS. Yes. SIBO can go away. None of these are death sentences. All of these things can go away. It does take some grit. It does take getting real honest about your situation, testing. I will say it's not easy. It's relatively simple, like following protocols. It's not always easy to find these, time and place to do it all, but it is possible. It just takes some grit, some motivation, and knowing that if you really stick to it and you're working with a good, thorough practitioner, your health will get better. Yeah. You just got to go through the process.
Absolutely. Yeah, it's so true. It's just I think when you can kind of tell somebody that and you tell them, it will be a little bit of a process, but you can do it, then that's just like, and these people that have been dealing with this for so long, most of the time they're going to say, I can do that. All right, let's get started. So I love that you mentioned that. My last and final question before I leave you with, where people can find you, anything else you want to mention is, you talked about actually something that I also get a lot of questions on my social about is, can you start treating mold exposure if you're still living in the environment?
I believe you can.
Me
I will
too.
use the analogy your body's a bathtub. We can start draining the tub. The faucet might be
Mm-hmm.
on, but we can start draining the tub. Now, depending upon the rate of exposure relative to the rate of clearance, it might dictate how far we're going to move along. But we can start. There is no harm in starting. It's just
Yeah.
hard to say how much we're going to progress. Probably depends on how bad
Yes.
the mold exposure is and if there's other biotoxins involved as well. So, yes, I do firmly believe you can start doing something. I actually just had a post the other day about like, here's some things you can do now while you're living in mold, because the
Oh,
reality
great.
is the day you figure it out and connect the dots that, oh my gosh, this is mold, you're not out of the house that day. You're not remediating tomorrow. Like these things
Right.
take a little
Yeah.
time. So yes, you absolutely can start supporting your body.
I love that you did a post on that. That was something I was thinking about writing a newsletter on because I'm such a big fan of like mineral nutrient supports, fats, making sure you're getting enough, like good nutrients and sinus sprays for sure. And then possibly maybe doing a little bit of like, just some binding, a little bit of like support just to kind of like you said, it's so like the body's a bathroom. I always love your analogies, but yeah, it's like we want to like, we might not be able to in the moment control what we're getting exposed to, but we can absolutely support how it's draining out of our system. And so we can do some things like that to just kind of support the body and like in the clearance of it, right? So it's not under what we call the toxic burden, not making the toxic burden higher.
hmm
Yeah,
Yes, we at least can try to stop it in its tracks and at least not make it worse. We
exactly.
can try to make it better. I
Yeah.
think Jill Krista kind of talks about that, like her analogy of I think it's the orange or the lemon of peeling
Oh,
back the
the
layers
orange. Yeah.
and starting to, I think it's protect is maybe one of her first
Mm-hmm.
things. And she really supports like food is medicine. And I think, fiber based binding using
Oh,
what
yes.
chia, I will sometimes, especially if a person has an oxalate burden on their body and they maybe not tolerating
Mm-hmm.
mycobiome very well, or they don't have access to cholestyramine prescription,
Mm-hmm.
Zymogen, Optoline, I believe,
Oh,
the
yes.
fiber-based powder,
Mm-hmm.
that's one that we can use. That's a one that I'll use with kids. Like we can
Oh,
add
it's
some fiber. It's
great.
just fiber.
Uh-huh.
It's just a tuber, right? And it's, I don't think, a high histamine tuber.
Mm-mm.
We can add that into smoothies. We can add that to water and drink it. So yes, there's some food as medicine things we can start doing, especially if the person is still going to be exposed for a while.
Oh, I love fiber. I love that you brought that up. And that's something we didn't mention when we were talking about Jill Krista, but food is absolutely medicine. The bioflavonoids, the polyphenols, the antioxidants that we get from our nutrients. Again, it's like what you talked about, the liver, like the liver needs a lot of these nutrients to support it, right? And oftentimes it's getting depleted. So again, that's so important. And I love OptiFiberline. That I think it's called glucomannan fiber
Yes.
is what it is, right? Yes. So that is absolutely wonderful to use. And like you mentioned, if we're dealing with a high oxalate burden, absolutely we can switch over to something that like that can be helpful. There's always an answer in helping to support somebody like drain, like whatever they're getting exposed to and support their bodies. I love that you talked about that. So, well, that all being said, this was such an informative episode. I want to leave it with you if there's any last words, final words that you want to mention for everyone listening. You are absolutely such a wealth of knowledge. So this was so wonderful getting to sit with you and talk about this again. So anything else you'd like to mention for people, and then like where people can find you, work with you, follow you on social, etc.
I think one of my biggest takeaways, having done this now for 4 years, working with patients one on one, is that the environment is such a big culprit that so many people don't think of. We have, like these labels of IBS, infertility, fibromyalgia, migraines. I am of kind of the mindset now that I cannot unsee how bad building biology is and how many of our health problems are a direct effect from our environment. So clinically
Yeah.
significant exposures. And I know I hear this all the time, or eye rolls of, well, all houses have mold. And that was something I had to work on with like my own family and my husband. Like, yes, all houses have mold, but we're talking about clinically significant.
Exactly.
And the harsh reality is at least 50% of homes have clinically significant levels of toxic indoor mold, other biotoxins that can grow from water damage, endotoxins, actinomycetes. I'm now personally just found out yesterday dealing with radon in my house. I mean, it's just
Oh, I saw that.
I'm just like, oh my gosh, like it's crazy how bad building biology is. The silver lining in it is you can fix houses and you can,
Yeah.
find the root issue with the house, kind of like our body, find the root issue with the house, implement what needs to happen to the house to make the house safer, small particle clean to get the residual out. And it almost always starts with getting a good environment in place. I know that can take time and resources, but I just think, the biggest aha moment I have is when people come to me, regardless of whatever the scheduling comment is, there's almost always an environmental component, the mold, heavy metals in the water, et cetera. And so I truly think people, I say this a lot in my social media, they hyper focus on a better, more perfect set of food rules. And most people don't need that. They need to get real honest about their air and their water. And it's so funny that's coming from a registered dietitian, because my original training is all in medical nutrition therapy. And I'm kind of like, I think that is a lot of what I call the green version of downstream symptom whack-a-mole. We're taking out this food, trying to manipulate the body when we're breathing in crappy air and drinking crappy water. And so I guess I'm getting long-winded, but take your water very seriously, take your air very seriously. You consume those two things more than any food you consume.
Oh, yeah.
You're breathing all day, you're drinking, you're only eating a couple times a day. Stop putting as much emphasis on your diet, even though obviously I believe a healthy, nourishing diet is important. I don't think it's as important as safe water and safe air. So that would be my big aha moment message.
I love that.
That we shouldn't have to eat perfectly to have perfect health. We should eat well most of the time, most meals, most days. But if that's not working, zoom out and look at your environment. That would be my big aha moment to share. Finding me, you can find me on social media. My handle, I believe, is at Functional Nutrition Dietitian. I talk a lot on there. You see me rant like every single day.
They're good rants.
It's always coming from a place of, I've been through hell with my son, my own health, with dealing with all these types of things. And I just want to help so many other moms, women, men, anyone who's struggling figure out their rootiest of root issues so you can stop playing downstream symptom whack-a-mole. Because I think about how much money and time and effort and lost years because I didn't have the rootiest of root issues figured out. So if you want to hear my rants, I rant a lot. Functional Nutrition Dietitian. I do have an online program called Healing from Mold that talks about like all these things we're talking about today. And my website is my business name, dieteticswithdriessens.org. I've got a blog and newsletter if you're looking for some free information. And then, like I said, my online course. I do take insurance as well, which I think is another unicorn thing. So that really helps a lot of people with accessibility. I think I'm the only shoemaker proficiency partner that accepts insurance in our country. So, I try really hard to stay as accessible as possible to people because I know how expensive this journey can be. But one other little Katie rant. People will sometimes say, oh my gosh, an ERMI is $240. This test is $350, whatever. You have to think about how much money are you spending on your prescriptions, your quality of life, missed time, all your sick days at home. Like, that also has a cost too. And so while yes, this stuff is expensive, arguably, I personally feel like now that we're like on the other side of it, we're actually not spending as much money because we're not, my son was seeing 8 doctors, all of his prescriptions, like that was expensive. So also you have to weigh the pros and the costs of
the time
investing in your health and your time and emotional, financial sanity, all that. And I will say most people, when they get to the other side, they're like, it was well worth it to get my health back.
Absolutely. No, like I said, you have like the best, the way you talk with people is because I wouldn't even call it a rant. Like, it's just like you just have such a way of like hitting home for people because you went through it yourself. And then these people are going through it too. And so, everything that you're saying and what you're explaining and what you're trying to educate people on is just coming from the heart. And it's just truly wanting to help people, which is just so profound, so wonderful. And thank you so much for your time today. I'm so, so grateful that we got to sit down and have this conversation again and just being able to, help more people and provide that guiding light. So thank you, Katie. Really appreciate it.
Well, it was an honor to be here. Thank you for having me on.